In an inpatient hospital room, Linda Smith, a 55-year-old office clerk, has been treated for 2 days for a urinary tract infection. After receiving antibiotics, her condition has improved and she is ready to be discharged. The nursing team is conducting a structured, evidence-based discharge planning process with a focus on patient-centered care and family inclusion.
Good morning, Mrs. Smith. How are you feeling today?
Good morning, nurse. I'm feeling much better today. No more burning when I'm running, and I'll try to rest more today and not rush back to work.
That's great to hear. Your temperature has remained to normal and your symptoms have resolved. And the doctor has approved your discharge today. And before you leave, we'll make sure you're well prepared and receive all the necessary information. And I'll double check the discharge summary for completeness.
Thank you. I'm ready to go home. Honestly, I was worried at first, but I'm so relieved it wasn't anything more serious. The care I received here was so wonderful. Please thank the team for me, especially during those first few days when I was in so much discomfort. I've learned about ignoring my symptoms, and next time I won't wait so long to come in.
I'm glad to hear that. Early intervention makes a big difference. I'll be right back with your discharge paper and medication list.
Alright, I'll call my doctor to let her know about my discharge. She will be happy, right?
Hi nurse, I'm Awalia, Linda's daughter. Is there any specific we should prepare at home?
As we have prepared Linda medication with proportion 100 mg to be taken twice daily for 7 days. She can also take paracetamol 500 as needed for pain or discomfort no more than 4 times a day. We include a medication box to help with organization.
So, we follow a special diet?
Usual, drink plenty of water. Hydration is key, and it best to avoid bladder intense like caffeine, spicy or acidic food for the time being. Other than that, she can resume her normal diet.
Let it make sure stay hydrated and comfortable at home. And I have reminder on her phone about the schedule to check up just in case it's forget.
That excites Emily. It's very helpful when family members are involved. Also use to confirm, do you have transportation arranged for the day? Or will you let us have coordinate arrange?
Yes, I have arranged for a car service to pick us up. It's just about 30 minutes.
Will she need any special equipment and supplies at home?
Good question. Other than the medication box and thermometer to monitor for fever, no special equipment is necessary, but do keep on eye out for any sign of worsening symptoms like increased pain, fever, or blood in urine. If anything seems unusual, don't hesitate to call.
Should we limit her physical activity?
Light activity is fine, but she should avoid heavy lifting or strenuous movement for the next few days.
Should she sleep in a different room? Or is it okay for us to share the bed?
It's fine for you to share the bed as long as she's comfortable and gets enough rest. Just be mindful of her movement and space, especially at night.
Is there any follow-up appointment we should be aware of?
Yes, we schedule a follow-up visit 1 week to check on her recovery, and she will repeat a urine test. The appointment details are in this summary.
Thank you so much for explaining everything. That's really helped us for more prepared.
You're very welcome. It's clear you want a very support family that makes a big difference in her recovery. Don't hesitate to call if you have any questions at home.
Thank you so much. Nurse Maya. Okay, so we are gonna taking our own car then.
Okay, sure.
The hallway was quiet as Miss John guided Mrs. Linda in a wheelchair. Mr. Smith and Emily walked closely beside them. Inside the discharge education room, Nurse Layla reviews Linda's medication carefully, double-checking each dose and labels. As the door opened, she looked up and smiled warmly, ready to begin the final step before discharge.
Yeah? Okay, Nana. Do you miss me? Good afternoon, Mrs. Smith, Emily, and Mr. Smith. I'm Miss Lila, and this is John. Before going home, I would like to give you detailed instruction to Mrs. Smith to recovery and prevent future infection. Let's start with the medicine. This one is Farkhan with the dose 100 mg. You can take it twice in a day after eat, and this medicine for 7 days medicine. And this paracetamol with the dose 500 mg, you can take it if you only need for free and don't more than 4 times in a day. And the important is don't stop or skip the dose, completing the full course, prevent antibiotic resistance or recurrence. Please return to the emergency room at Hope Health Hospital or call us immediately if you develop a high fever or chills, pain in your lower abdomen or back worsens, there is blood in your urine, your experiment difficulty or inability to urinate, you feel nauseous, vomit, or become confused. This could indicate the infection has spread to the kidneys.
I got it. We must monitor her temperature daily.
To support your recovery, first is drink at least 8 until 10 glasses of the water daily and wipe from front to back after using a toilet and empty your bladder regularly and completely and avoiding coffee, alcohol, spicy food and acidic juice for the next week.
Can she do any physical activity?
Yes, she can. Avoid strenuous exercise of heavy lifting for a few days and light walking is okay. We'll schedule a follow-up appointment with your primary care physician in 7 days. At that visit, they will review your urine culture result and assess whether symptoms have fully resolved and decide if medication needs to be adjusted. Sometimes, lab results show bacterial resistance to the initial antibiotic, so this follow-up is very important.
If you ever feel uncertain about any medication, symptoms, or follow-up, you can call our nursing hotline, use the patient portals for the check lab result or send message, and visit the clinic or emergency room if something feels wrong, and it's always better ask than wait. UTIs can be worrying, especially if they recur, but with the step we discussed, you can reduce the risk significantly. We support to you every step that the way.
Would you mind back what you remember about the medication and the warning sign?
Sure. I need to take Zefarhansyah twice a day with the food for a week. And if I got a pain, I can take paracetamol 4 times a day. And if I got a pain and fever again, I should come back here immediately.
Perfect. Thank you, Mr. Smith.
I really appreciate how thorough you have all been.
Nurse Ella and Nurse John walked side by side down the hospital corridor, their steps steady and purposeful. As they gently knocked and entered the room, they were greeted by warm smiles. Mrs. Smith sat upright in bed, her eyes bright and relieved, while Mr. Smith stood beside her, clearly enjoyed by the news of her going home soon.
Hello, Mrs. Smith and Mr. Smith.
Here is what we've given to you, a follow-up appointment hospital contact card, and this a warning sign and medication schedule. Before we leave, may I ask, everything is clear?
Yes, everything is clear. I feel confident to going home.
Okay, great, Mrs. Smith.
Would you please sign the form confirming if you that you accepted and understood all discharge planning instruction?
Sure. With empathy communication, teachback evaluation, and holistic approach, the nursing team ensured that Linda was not only clinically stable but also emotionally supported and well-informed. This person-centered discharge planning reflects best practice in safe transition, reducing readmission risk, and improving long-term outcome for patients with urinary tract infection. Nurse John entered the patient room with a wheelchair, smiling warmly. Inside, Mr. Smith, Mrs. Smith, and Emily were waiting with visible joy on their face. Mrs. Smith looked ready and excited to go home. Emily gently helped her mother sit in a wheelchair, offering support with care. She gave her mother a serene smile, holding her head tightly. Nurse Laila and Nurse Maya soon joined them, their expression bright.
Thank you everyone. I really appreciate your kindness.
Today's experience much less frightening. We are so grateful.
I feel informed and ready to help my mom recover at home.
Don't hesitate to call up if anything gets worse, and we're here to support even after the discharge. If you notice something unusual, please call us.
We miss you here, but we're happy to see you well enough to go home. All the best for you, Mrs. Smith.
Take care, Mrs. Smith. We have your recovery is smooth and complete.
Discharge isn't the end of care, it's beginning of healing at home. Every plan we create is the bridge between the hospital and healthier life. As nurses, we don't just send patients home, we get them forward. Because your health is not just your journey, it's part of ours too. We celebrate every step you take toward recovery. Because your strength inspires us. And even after you leave, a part of our care goes with you.